Bill C-273 is a private member's bill now in the House of Parliament that would ask parliamentarians to review a national strategy concerned with implementing a basic income in Canada. It's not the first time such a question has been raised, but we're hearing more of it as this COVID pandemic has brought to the issue the vulnerability of some Canadians and the kind of help that could be provided. Evelyn Forget is with us now. She's an economist and a professor at the University of Manitoba and author of the book, Basic Income for Canadians, From the COVID-19 Emergency to Financial Security for All. Evelyn, great to have you with us.
Happy to be here.
So let's just start with the premise here. Basic income is something that has been talked about for a long time. The single most frequently raised concern about it is if you pay people, they won't work. If you give people a guaranteed income, another word for it, they will stay home. What has the evidence showed over the years when this has been tried in pilot programs?
Basic income's been piloted all over the world in high-income countries like Canada and Finland, the Netherlands, in middle-income countries, in low-income countries. And every time it's been tried, the evidence has been the same. People who were working before the basic income was introduced continue to work. They don't change the amount they worked. There's sometimes slightly different effects for smaller groups, but people who choose not to work usually are spending their time doing something else. An early experiment in Canada called Mincome in the 1970s suggested that young men, for example, tended to work less because they were more likely to stay in high school and to graduate from high school.
So the basic income puts a floor on income. It says there's a certain amount people should, as a kind of a right, will provide for them. What supports would it replace? Because presumably there are different forms of various support across the country. Are there a bunch of programs that would, in this ideal world where we've just established a basic income, we would do away with a bunch of other programs?
A basic income is designed to streamline and simplify cash transfers from various levels of government to individuals, but it doesn't replace specific supports to deal with specific concerns. For example, people with disabilities might require help to acquire assistive devices, for example, hearing aids or wheelchairs. Those kinds of things would remain in place. And similarly, big social programs like healthcare would still be necessary, even with a basic income. But what a basic income would replace is all of the different ways that various levels of government deliver cash to individuals. So, for example, provincial income assistance, things like the GST credit and its provincial counterparts, those sorts of things could be streamlined and included in a basic income that would be both more generous than the existing set of programs and easier to acquire.
The pilot project or study that was underway in Ontario, it didn't last that long, Evelyn, but it bore out what we've seen elsewhere. And some of the findings were pretty compelling. Things like people who received it went and got education to get a better job. They improved their living circumstances. They took a chance on a job that they might not have taken a chance on and improved their situation that way. But also metrics like visits to emergency rooms, healthcare issues, depression, rates of suicide, mental health changed completely for the people in the pilot program. That was cut short. How much of the conversation about this basic income is ideological? Some people just are never going to like it. And how much of it is based on real data and study over time?
Well, in terms of the evidence, I think the outcomes, the results of a basic income are pretty compelling. People do spend the money in responsible ways. By and large, people do improve their health. Both their mental and physical health improves. People tend to acquire more education. It makes people's lives better. So quality of life improves. All kinds of very good things happen as a consequence of basic income. I think some of the real concerns about basic income tend to focus in two particular areas. No matter how much evidence we acquire and present, there are always people who believe that if you give people money for nothing, the recipients will work less. And the other concern is the cost of a basic income. And so in some ways, the concern, I think, is not so much an ideological one, but is it worth the benefits? Is a basic income worth the investment?
And that's an important word, investment, I think, because it would be a costly program. PBO estimates, of course, have put dollar figures around what a national program might look like. Do you worry that, as somebody who's been watching this a long time and I think believes in its value, that given the state of government finances, it's just not the time that you would see governments willing to entertain this kind of a project?
Well, actually, the cost estimates for a well-designed basic income program put it well within the range of programs we've decided we can afford. So it is something that we could afford in the Canadian context. And I think that we all also recognize that the economy's been changing, society's been changing over the past 30 or 40 years, and our social safety net hasn't been changing along with it. So what we have is a lot of very expensive programs that we're currently running that don't do the job very well. Provincial income assistance is a key one, employment insurance. The reason we had to introduce all of these emergency supports when the pandemic came along was because employment insurance was simply not up to the task of supporting Canadians through the transition of the pandemic. And so I think we are inevitably moving towards a situation where we have to rethink the way we deliver social programs. And I think a basic income is simply a more rational way of delivering those programs. This is an opportunity to do some of that thing.
And as you allude in the subtitle of your book, the pandemic may have changed some of the thinking around this for people who hadn't thought of it before or who thought differently before. Do you think Canadians are more open-minded today about the idea of we're all in this together and let's make sure everybody's okay, because that was sort of the spirit that we carried through this pandemic?
I think we began that way. I don't know how much of it will persist after the pandemic ends. But I think one thing became very clear during the pandemic, and that is that a lot of Canadians who never really thought very much about the social safety net were introduced to some of the limitations of the programs that currently exist. So now we're aware of the problem. All of us are aware of the problem. The question is what we choose to do about it.